Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Some estimates say that we spend more on administrative burden in the U.S. marketplace than actually pay for pharmaceuticals in the U.S. market, which is astounding to me.
Welcome to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. He's Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, he's an economist, and he's Chief Science Policy Officer at Global Healthy Living Foundation.
And across the country in Seattle, Washington, he's Connor Mertens, a very good friend of mine, who is a patient advocate and community outreach manager at Global Healthy Living Foundation.
And if you're tuning in, you know our goal is to help simplify the complexities in healthcare economics and policy issues for you, the listener. So Robert, as we start the series, it's always exciting to read listener comments and feedback. You ready?
Absolutely. This is my favorite part of the podcast, to hear what other people have to say.
Feedback this week comes from Alsalas12, who writes, "Wonderful. What a great listen. Short, concise, to the point. That feedback is good."
Absolutely.
We want to make it quick. We want to make it understandable
For patients and individuals who listen to it to take away something important from every podcast.
Again, that review is from Alsalas12. Thanks for your review. We invite all of our listeners to go to Apple Podcasts and leave an honest 5-star rating and a positive review. And don't forget that wherever you are, hit that subscribe button so you never miss an episode.
So Connor, let's start with the episode.
This week, Robert, we're picking up on a conversation from last week, which is, what is the Build Back Better plan for patients? We kind of discussed what it meant, what it does, and what it's lacking. And I always think it's important for us to address the question of what can be done about it. How can this be better for patients? I think we should start off with that. What do you think can be done about this legislation to make it better for patients?
Thanks, Connor. That's a great question. Commonly, as policy wonks and economists, when we sit around, we complain about things and the wrong policy solutions or legislative opportunities, but we seldom do is provide input about how policymakers can do things better to improve the patient's experience and ability to pay for their pharmaceuticals. So in this episode, what we're going to do, we talked about last week, was what does Build Back Better do to help patients and some of the shortcomings. But in this week's episode, we're going to concentrate on what can be done as part of Build Back Better or separately to really help patients when they show up to their pharmacy in their next visit to pick up their medicines. So one of the things that we want to talk about is, for example, what the federal policymakers should have done is to outlaw rebate contracting in the marketplace for pharmaceuticals. Rebate contracting has many issues with it. It creates misaligned incentives in the market where more expensive drugs are preferred over less expensive medicines, which is not intuitive because at the end of the day, the whole purpose of having an insurance card or a pharmacy benefit manager overlooking your pharmacy benefits is to cover the less expensive medicines first. But for the minimum, what they should have done if they couldn't outlaw the rebate contracting model is taken all of the rebates, concessions, fees, everything that is collected by a pharmaceutical industry, by the pharmacy benefit managers and the insurers, and pass that back to the patient at the point of sale when a patient has a coinsurance or a deductible for the medicine that they're paying for.
And I think that this is especially important in the instances when we're talking about Medicare. What else can be done about Medicare? Something that constantly comes up, and I think we even mentioned last week, was about letting Medicare negotiate prices. It's a wildly popular and bipartisan idea.
Yeah, I think negotiation is fine. We just have to be worried about what the consequences of that negotiation would be with regards to the impact on research and development, introduction of new therapies in the marketplace, and access to the current therapies that are available. In addition, we need to be honest about it. Negotiation is not going to lead to lower out-of-pocket costs for patients in any way, shape, or form. In fact, it's a false promise. What Medicare should have done, in fact, that they didn't do with Build Back Better, and we talked about it a little bit, is to create a better model where they have audit rights of the pharmacy benefit management and insurance companies' books to be able to say what is the amount of concessions, fees, rebates that they collect from the biopharmaceutical industry, and what percentage of that is being passed back to the plan sponsor, whether it's the government, the employer, or directly to the patient. It is just mind-boggling how the largest payer of biopharmaceuticals in this country, the federal government, has no audit rights and oftentimes relies on faulty data, which are dated, or is based on estimates, or based on worse testimonies of PBM or insurer, pharmacy benefit manager, or insurer executives. And they rely on those type of data points to make these massive policy decisions. So that was a big miss here, that the federal government didn't mandate audit rights of the books of the pharmacy benefit management companies and the insurers to see where the money flow is going. But again, what we need to do is keep our eyes on the ball. We need to help patients. And what would have helped patients is to be able to make sure that they get all of the concessions that is gained on their behalf through negotiation with the biopharmaceutical companies at the point of sale when they show up to the pharmacy counter the next time they have to pick up the medicine.
And I think that when we discuss things about audit rights and the ability to even check on the transparency in the supply chain, this is something that should be done in the bill. And things like outcomes-based reimbursements for medicines or mandating pharma explains their pricing structures. What are some other ways that can be done to increase the transparency?
Connor, you're absolutely right. That's another missed opportunity with regards to the pharmaceutical industry and keeping their feet to the fire to make sure that when they bring products into the market, they deliver the outcomes that it's promised to the patients. So one of the ways that Build Back Better would have been better, in fact, was to institute what is called outcomes-based contracting or mandate outcomes-based contracting for certain medicines that rely on outcomes for patients that may be questionable or perhaps outcomes that are very unique. And these medicines cost a lot of money, and the only way they should be reimbursed if they deliver the outcomes that was basically promised to the market when the product was brought and marketed for patients. So that's one opportunity. The second opportunity is really to have pharma companies explain their pricing model in a transparent manner. For some odd reason, we've created cottage industry after cottage industry of trying to estimate what the net price of the drugs is, while we know that the pharmaceutical industry is the best proponent of how they brought the product and how they priced it. And for some odd reason, they're not able or unwilling to explain their pricing models transparently in a marketplace. And hence, they create these cottage industries, such as Institute for Clinical and Economics Research, ICER, or SSR Health or IQVIA, which end up estimating all of these net expenditures instead of coming out publicly and saying, look, I priced the medicine as X, and this is why I priced the medicine as X. Let me explain it to you, and do it in a very analytical fashion rather than just a bunch of rhetoric and words. Those are two missed opportunities that would have helped the marketplace, would have kept the biopharmaceutical industry's feet to the fire, and ensured that we have a better understanding how products are not only priced, but that they deliver the outcomes that they have promised to the patients.
When we're talking about focusing on outcomes rather than bottom lines, I think that it's super important for us to wade into discussions of admin burdens. And that includes step therapy or non-medical switching, formulary exclusions, all topics that we've covered in past episodes. Don't forget to check them out, leave a 5-star rating. But I think that this bill should include some more admin, lightening the load for admin as far as prohibiting non-medical switching or formulary exclusions. What do you think?
That's a third miss, right? So you brought up another thing that this legislation doesn't address, which is the administrative burden in the United States, which is exorbitant. In fact, some estimates say that we spend more on administrative burden in the US marketplace than actually pay for pharmaceuticals in the US market, which is astounding to me. Again, there are ways to reduce the burden, to create more transparency when policies such as non-therapeutic switching or therapeutic substitution are in place, or to create transparency of why formularies, for some odd reason, are covering more expensive brand name drugs instead of the same generic that is available. In fact, in some cases, an authorized generic, which is manufactured by the same brand company. These are the type of things that would help create a better marketplace, not only to be able to create some transparency and understanding of which medicines are covered, but it is also important for us to be able to reduce the burden of administration of healthcare benefits, which costs billions of dollars, and it's unnecessary cost that doesn't provide any kind of help for patients or improves the patient's health.
So right now there are other pieces of legislation that do impact some of these issues we've brought up. The Safe Step Act can combat step therapy, or the No Surprises Act and things like that. But what I think the Build Back Better plan misses is the ability to do it in a sweeping manner that would impact a lot of folks at one time. And a topic we've discussed a lot is the ability of federal legislation to impact more patients than is on the state level. But I think it is important for us, as you mentioned, maybe in the last episode, where there are state models for a lot of these things that we should be looking to. Robert, I really appreciate us diving into what should be done. What do you want folks to walk away with?
Connor, a few things. Number one, Build Back Better plan has some good parts, but it misses the main point, which is to help patients with their out-of-pocket spending when they show up to the pharmacy the next day after it passes through legislation. There are better ways to help patients with their out-of-pocket cost reduction that we are trying to propose through Build Back Better. One way would be to eliminate rebate contracting, or for the minimum, to make sure that all of the rebates, concessions, and fees are passed back to the patient at the point of sale, at the pharmacy counter, when they are about to pick up their prescription. Two, what we should have done through Build Back Better is institute policies such as outcomes-based reimbursement or better transparency on how drugs are priced. And instead, we didn't do that. We walked away from it, and that was a big miss. And the third big miss, frankly, is what we talked about, which is reduction in administrative burden in the US marketplace. Our healthcare professionals, our healthcare system is burdened with huge impact through these type of administrative issues. And unless we address that, we're not going to be able to reduce healthcare costs meaningfully in the United States. So the three things that we would promote and propose that needs to be done to really help patients, create better transparency, provide audit rights for the government, and finally to reduce the administrative burden on healthcare professionals are things that would have meaningfully helped the healthcare system. We hope you learned something too. We'd love to hear from you about the Build Back Better plan and how it should be improved. Send your emails to healthcarematters@ghlf.org, or better yet, include a short video or audio clip.
And who knows, whatever you share may be included in our listener feedback portions in future episodes. Thanks for listening to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. And don't forget, if you like this episode or love this episode, please go to Apple Podcasts and leave an honest 5-star rating and positive review. And wherever you're listening, don't forget to click the subscribe button so you never miss an episode. As always, he's Dr. Robert Popovian.
And he's Connor Mertens, sitting there in Seattle, Washington, thinking, when is the NFL season going to be over? See you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.